To you, Smitty.
Well, hi everyone who's joined so far. I anticipate we'll continue to get people joining as we go. Um, for those who don't know me, my name is Kyle Smitty. I'm an attorney at the United States Department of Justice in the Civil Rights Division, and I'm going to be giving an update on the settlement agreement that was signed with the Commonwealth of Virginia about supporting people with developmental disabilities. I've been involved in this case for almost 9 years, and this is my 8th convention in a row. I'm now going to let Jessica introduce herself, and then I'm going to put up the slides.
Hi, everyone. My name is Jessica Polanski. I'm another lawyer at DOJ. And I just wanted to say hi to everyone. It's been really wonderful to see so many of you at different parts of the convention. It's been, some old faces that it's been wonderful to see and some new faces, and it's a little harder to say hello at a virtual convention. So I just wanted to take this opportunity to say hi to everyone. And thank you for everything you're doing. And Smitty's now going to talk a little more about what we're doing from DOJ's perspective.
All right, let's see if this is working. Hold on. Okay, Tanya, can you give me an audio that you can see this?
I will let you know. I don't see it at this time.
Okay, good. Or not good.
Yep, it's coming up.
Now you have it.
Yep, and you'll put.
There we go. Okay.
Perfect.
Now we are good. Okay. So as I said, this is an update on the settlement agreement. If you want to see these slides, Tanya can put a link in the chat box so you can scroll through the slides at your own time. I want to first say, I've been involved in this case and been getting to meet people across Virginia for 8 years. And in a way, you guys have become a little part of my family. In fact, my wife and one of my daughters came to one of the conventions in Williamsburg years ago. And I just wanted to let you know that there's been a big development in our house. 2 hours ago, my 5-year-old lost her first tooth. And she wanted to make an announcement to all of you, and I told her I would take a picture. So here is Kate with her first tooth lost on the right, and then my daughter, Anna, on the left. So they continue to grow as I do in this case, now 8 years into the settlement agreement. So for those who are new to this, the investigation that brought the United States Department of Justice into this case started 10 years ago in 2010. And a year later, we found that Virginia was violating the rights of individuals with developmental disabilities under the Americans with Disabilities Act. And a year later, in 2012, we reached a settlement agreement, the United States did, with the Commonwealth of Virginia to make changes to their system that would take at least 10 years and would cost millions of dollars. And that is what has been happening for the last 8 years, 8.5, 9 years that I've been involved in this case. At the beginning of the settlement agreement, there's some goals that are put out. And one of those goals is, the major goal is to prevent unnecessary institutionalization of individuals with developmental disabilities and to provide them opportunities to live in the most integrated settings appropriate to their needs, and to ensure that services are of good quality. Those are quotes from the beginning of the settlement agreement. What does the Department of Justice do with this settlement agreement? We do 4 basic things. We meet with stakeholders like yourselves. We review data and documents and records. We meet with the Virginia leadership, folks that have come on during this convention. We meet with them regularly to discuss our evaluation of how they're doing. And then we meet with the federal court. We do status conferences with the court, and I'm going to end my presentation in about 25 minutes with discussions about what's happening there. We also meet with the independent reviewer, Donald Fletcher, who some of you have heard about. He is independent. He kind of works for the court, and has written now more than 15 reports that are public that give his analysis and evaluation of how Virginia is doing in complying with all the things they said they would do. So I'm going to start by talking about COVID, although we've had conversations about COVID-19 with many of you over the past week. There's two websites that you should all know about, Virginia's website and the ARC's website, both which have information for providers and for individuals. We've contacted some providers and some individuals and families over the last 4 months to get personal stories and to understand whether individuals' needs are getting met, how virtual services are working and not working, and also to find out how the Virginia leadership is doing in communicating long-term plans to providers. We've heard lots of frustration from the community, and we will take those comments back to the state to explain to them what we've heard and how serious the situation is, and how making sure that individuals' health and safety comes first in light of this pandemic, even while we have the settlement agreement happening and has been happening for 8 years. So I'm now going to turn to 7 topics in the settlement agreement. I've talked about these topics at other ARC conventions, and these are sort of the basic pillars that the settlement agreement requires Virginia to accomplish. And remember, this is an agreement because Virginia agreed to do these things with the United States Department of Justice. And there is progress in all of these places, and there are still a lot of work to do in a lot of these places. So I'm going to give you highlights of what information we have about each of these provisions, each of these topics. The first topic is the DD waivers. So Virginia, as of today, has created 5,769 waiver slots. That's almost 2,000, more than 2,000 waiver slots than they were required by the agreement to create at this time. They were required to create 3,735 waiver slots. And I think this week we heard that right now, DMAS is putting out to the CSBs a brand new group of 810 waiver slots for this current fiscal year of 2021. 640 of those are for the family and individual living waiver, which is the second waiver you see there at the bottom where it says the totals. And about 145 are community living waivers. We were told by the state that the CSBs got a heads up about these slots coming online a couple weeks ago, so they've already been starting to prioritize individuals. So if you're on a wait list, this is a good time to make sure you're in touch with your case manager and your CSB, because those waiver slots are coming out. Now, with regards to the wait list, there are priorities in the wait list, and priority 1 is going to get first priority. There are about 3,000 people on priority 1 out of the 13,000 people that are on waivers. This is kind of incredible. When this agreement started in 2011, there were about 5,700 people on the wait list. Now there are 13,000. And remember, Virginia has added 5,700 waivers, waiver slots. So even with the great adding of slots, lots more people have come on to the wait list. Many of those people are children. In fact, a vast majority are. And it shows that the settlement agreement, the work of the ARC, the work of advocates has raised the bar to demand from the state to be on wait lists and to be considered for waivers. It's really, I think, shows how engaged the community is in Virginia. And then the next step is to start to work with the General Assembly, as you guys do, and to work with the state to make sure that priority 1 gets filled first and people get waivers. You can see the totals of the amount of people who get DD waivers right now: 11,000 for community living waivers, a little, almost 3,000 for the family and independent living waivers, and then about 300 for the building independence waivers. I want to speak about two other things on this slide. One is the training centers, which was a part of the settlement agreement. DOJ required that 4 of the 5 training centers close. That has resulted in 900 people over the last 8 years moving to community settings. It's an incredible accomplishment of the state. There have been other states that have not done well on these transitions. The independent reviewer has found that this state, Virginia, has done remarkable at keeping people safe and healthy, and then improvements in people's lives have happened as a result of those people moving from the training centers to community settings. Today, there is one training center that is currently open. The last one closed in April of this year, Central Virginia Training Center, and the one that is open is Southeastern Virginia Training Center, which will have about 75 beds. The last thing I wanted to say is the DOJ remains committed to Virginia's commitment to keep children with developmental disabilities out of nursing facilities. This case is about necessary institutionalization at its heart, and there were about 50 kids with developmental disabilities as of March 2016 in nursing facilities. Today, there are still about 50 kids. It's not the same 50 kids. It turns out that about 25 of those kids 4 years ago are still in nursing facilities, but many have been able to find community settings, and Virginia's leadership has worked hard to find those individuals' community settings and the supports around them. And yet they also found an additional 25 new kids who came into nursing facilities. So that's still a commitment of the DOJ, and there are some compliance indicators before Virginia can get out of the settlement agreement to work on that issue. So now I'm going to turn to family supports, also known as the Individual and Family Support Program. This is really targeted towards people who are on the waiting list and who do not have a DD waiver. This was a requirement by the settlement agreement that Virginia provide families on the wait list resources, including a financial resource for at least 1,000 people each year that they could get a yearly sort of stipend that they could use to get reimbursed. I'm sure some of you have used this. To date, let's see if I can move, hold on 1 second. I'm moving my pictures of everyone to the top so I can read the slide. To date, they have supported 17,450 family supports since the agreement. Some families may have gotten them in multiple years, but that's the amount of family supports that have been provided. That is nearly $19 million that have been provided in cash funds to family members to pay for things like therapeutic horseback riding and musical instruments. I've seen examples of these. I think this is a really wonderful thing that did not exist before the settlement agreement. It's not a lot, but it's something and it means a lot to those people. In addition, the Individual and Family Support Program not only requires kind of a cash fund, but also a way to connect people to resources. And so the agreement requires that Virginia create a model to do this. And this is a picture of that model. This is taken from the independent reviewer's most recent June 2020 report on page 92. It shows kind of 4 different areas that the Individual and Family Supports Program is working on. 3 areas in addition to the cash funding. One of those is peer and family program that would support peer-to-peer and family-to-families through the Partnership for People with Disabilities. Another part of that model is a regional council that would help connect people to resources in their community. And a third is a new community website that has been active for about a year. I really encourage everyone to write down this website or keep track of my slide and to look at this website. It has information about how to access and connect with the people on the regional councils if you're looking for resources. For new families who know nothing about, who are sort of lost in my conversation right now, don't even know what a DD waiver is, this website has documents that the state has put together in the last couple years that outline that and can really help families start to navigate all of the different options that are out there for them. You can also find providers in your area. If you're looking for a supported employment provider, you can search in those top places. So that website is a good resource that didn't exist even a year and a half ago. Next, I want to talk about housing, number 3 on the list. Excuse me. The settlement agreement had a very small piece, small requirement about housing. It only required that about 28 people get independent housing in a pilot program. But the idea behind this 10 years ago, or 9 years ago when we settled, was that the pilot program would be able to show that money should be spent in this area and it's worthwhile to do it. And if they could succeed with these 28 people, the state might be able to convince the General Assembly to spend more money in this area. And in fact, that's exactly what happened. Fantastic, really good result. Virginia has served hundreds more to live in their own home. An own home means non-provider owned or operated, leased or owned by the individual, by creating a state rental assistance program, meaning I could now take this money and help pay my rent. It's money that the state sets aside for individuals to live independently. If you're interested in this program, or you know someone who is, or at some point 2 years from now, you remember I gave this talk and you have these slides, you can go to this next slide, which is the website where you can find the phone numbers of the housing specialists who their job is to work with someone like Kyle Smitty who wants to live independently and figure out what barriers are making me, are in my way from living independently, and try to break down those barriers so that you can live independently. They've worked with most of the 1,034 people who live independently now and have tried to help make sure that that's a reality for them. These are people who work for the state. I think they gave a presentation earlier this week, and they really care and believe in this program into moving forward with letting people live more independent lives. Number 4, employment. The agreement, the settlement agreement requires that Virginia set employment targets and that they work towards meeting those targets. So 4 years ago, Virginia set a target. It was a target that was developed with advocates, and it was kind of nationally recognized as a good target. 25% of the total number of individuals with intellectual and developmental disabilities would be employed. And what they did was they looked at who are the people who are most likely to work. That's 18-year-old to 64-year-olds. And then they looked at waiver and waitlist, which ended up being about 18,000 people. You can see that number, 17,964 as of last year. And they tried to say, we want 25% of those people getting some sort of employment. And they got close last year. This is important to understand what this number means. It includes people who are getting support through DARS and through the waiver. DOJ was very focused on making sure that people under the waiver started to get employment services and worked on that. Is there are we okay that the interpreter has stopped? Just want to make sure, just give me a thumbs up if that's okay. So for waiver funded supported employment, they also set targets, and these are much smaller numbers. They're numbers that have been increasing, which is positive. And their targets are still solid, important targets that the independent reviewer has thought would lead them to making good results. You can see in 2019, they were behind, that's the yellow highlight, on their targets. I think what's really frustrating about this, obviously, is that COVID has had a huge impact on employment overall in the country, and it really hurts the developmental disability community. So these targets are still commitments by Virginia before they exit the settlement agreement, and so we intend to hold them to making progress in reaching these targets. It's going to get paused, I think, because of COVID. So we'll see how that plays out. But I wanted to make sure that there was a public document that showed these targets. This is also on Virginia's library when they keep track of that we had a presentation about at noon today. So now I'm going to turn to the fifth topic, which is crisis services. Crisis services, there's a requirement in the agreement that Virginia set up a crisis system for people with developmental disabilities. This didn't exist 9 years ago at all. There were no funding, no staff. You would just call 911. This is a mixed bag. I think 8 years in, I've heard some really remarkable success stories about the REACH homes. REACH is the term that people usually associate with the crisis system. And I've heard really positive stories about mobile crisis REACH workers who come out to de-escalate crises. I've also heard really horrible stories about REACH not working. And that's gonna happen when you're doing system change, but it's not acceptable and we need to keep working on it. There were 3 sort of areas in which the crisis system is supposed to work. So one is in prevention before crisis start, so to help train staff about how to de-escalate so they don't need to call a specialist. Then the mobile crisis REACH teams who should come out to de-escalate or work with the family, work with the individual, form relationships, and help provide support when there's a crisis situation to prevent the third thing, which is going into a psychiatric hospital. And so there are these crisis therapeutic homes, often referred to as REACH homes. And so I'm going to cover each of these areas in a second. I'm going to talk about some positives and then some concerns. So the positives is that despite more than double the number of crisis calls in year 5, which was basically the last year, versus year 2, which was basically 2016, REACH staff continue to respond on site within the required average response times. This doesn't happen every time, but it happens on average, and that's a good benchmark to look at. There's also a lot more calls that have been happening. That can be seen as a good thing or a bad thing, and we don't really know exactly how to interpret that. A good thing is that people see REACH as a resource and reach out to them. A negative thing is that there's a lot more people calling, but it doesn't mean we for sure know whether it's a negative or positive. The next bullet is that fewer children who got REACH mobile crisis services were admitted to psychiatric hospitals. What this means is if I have a child who and we call REACH and they come to my home and help de-escalate the situation, if they come to my home, it's less likely that my child is going to end up in a psychiatric hospital. Now, what is often happening, however, is that REACH isn't being called first, and 911 is being called, or the CSB is being called, and people are ending up in hospitals, and then REACH gets involved. And when REACH gets involved at that point, it's often already too late, and the escalation has happened, and a psychiatric hospitalization is on its way. But when REACH is involved early, better outcomes happen. And that's sort of the goal and the plan. And so it's nice to see that the data is showing us that. The third is that children and adults admitted to state psychiatric hospitals. So even when people are admitted to the hospitals, over the last 4 years, the length of stay that they're in the psychiatric hospital has reduced. For adults, it's reduced from 61 days to 22 days, a pretty substantial reduction. Part of that is because REACH has been more involved in the psychiatric hospitals than they were even a couple years ago. And that pressure that DOJ, that the state has put on REACH to do that has made a difference. But that doesn't mean that there aren't still really big problems with this. Increased admissions to psychiatric hospitals continue. You can see the numbers there from year 2 to year 5. This next bullet point is about whether between October 2019 and March 20, so in about a 6-month period, 30% of children and 33% of adults received REACH crisis assessment in non-hospital settings. And Virginia has committed to making that 86%. And the reason is that if REACH is visiting people in their homes and not in a hospital setting, there's a more likelihood that they'll be able to intervene in the situation and make things better before they get escalated to psychiatric hospital. The last thing is that the monitor did a study in the last 6 months and found that there were 78 people in his study that needed behavioral specialists, and 45 of them could not access behavioral specialists. That's real-time data that shows the state that it's not doing what it needs to make sure people have the services that they need. This goes back to Lily's question right at the beginning in the chat room that said, you know, you can't just have it on paper, you actually have to show outcomes. This is one of the ways we're keeping track of an outcome that needs to get better. These are the crisis therapeutic homes. There are 5 for adults. And part of the problem in the last couple of years is that those beds have not been open for people because the short-term stays have turned into long-term stays. And so Virginia has created 2 long-term homes where they can move people from the REACH homes to these homes so that the REACH beds open up. This is something we expect to kind of watch over the next year to see if it actually works out. The children's homes have been woefully behind. They were supposed to create these years and years ago, 7 years ago, and have now created them. So we'll be watching very closely to see if these provide new resources for families. So I've got two more topics I'm going to move through. Case management. I don't want to spend a lot of time on this, but I wanted this slide to be in the record so that you all had it. It's important to know that Virginia has created a case management steering committee, basically to look at case managers and find out from them what is it that makes their jobs harder. And so the point of this is that they have produced a report that's in the library that shows how case managers are doing and what problems they're facing. And so Virginia is acknowledging that there are lots of problems with what case managers are trying to do. And, you know, I was once a case manager as a social worker, and what you want to do is be able to spend time with consumers and help make their lives better, not spend time on other things like all the paperwork and not having enough time for people because your caseload is unmanageable. So Virginia, in that same report, the next slide talks about some of the actions they've taken to improve the lives of case managers, which will improve the lives of individuals who they're serving. I'm not going to run through this, but this slide is up so you guys can ask questions about it when we get to that portion of this. The last topic is quality assurance and risk management. Those are fancy words. Providers know those words, but families often don't. I think of this as basically, are the services good? Is there quality in what is being provided to you? And there's a ton of work to be done in this area. This is a huge portion of the settlement agreement. It is really about, can the system that we have been working on for the last 8 years continue and be good for folks as we go forward. We've reached DOJ, the Department of Justice, and Virginia agreed to compliance indicators that must be met before achieving compliance in this area, which covers the following topics. And those are 12 of the topics. This is the place where Virginia is the farthest behind. They will acknowledge that in court to you all. There's a lot of work to still be done in this area. And we're going to be continuing to watch this very, very closely and to be putting pressure. And you'll probably hear us in court talk about this over the next year. So court. We've been really busy in the federal court. There's a federal judge, John Gibney, who oversees this case. When I spoke last August, we were getting ready for a hearing that was going to happen in January that the judge had ordered us to work on in April of 2019. He wanted the parties to get together and basically come up with a roadmap of how Virginia can get out of this agreement or how they can succeed in this agreement. And in January, there was a court hearing that DOJ had experts. We hired 2 experts. We worked long hours preparing this hearing to explain to the court why Virginia needed to do X, Y, and Z to get out of the agreement, to succeed in the agreement. And there were disagreements, and the judge listened to both sides and helped us to find agreement on these compliance indicators, which is the word that's on the top of your screen there. That's a fancy word for the measures that they have to do to get out of before they can get out of the agreement. So on January 14th, we submitted to the court a list of about 50 provisions and 328 measures or compliance indicators that were agreed to that Virginia will be working on to come into compliance. On January 14th, the DOJ then submitted a court filing to on April, I got lost. On April 1st, the Department of Justice submitted a court filing listing all 120 provisions in the settlement agreement, explaining that 70 of those provisions are in compliance and 50 of them are not in compliance. That aligned with what the independent reviewer had found in his December 2019 report. So we were in line with the independent reviewer. Those 50 provisions are the hard provisions. They are the outcome provisions. They are real. There's a lot of work to be done on those provisions. And we made that filing on April 1st. Then on April 15th, we had a court hearing with the judge via virtual and explained the progress that had been made from Virginia. And we'll be having another hearing on September 23rd about the progress that is being made to try to reach all of those compliance indicators. Jenny Schott of Department of Behavioral Health and Developmental Services was asked during the library presentation, well, what happens if they're not in compliance? The presumed end of this agreement is June 30th of 2021. Well, I can tell you what happens is, because it's set out in the settlement agreement, by January 1st of 2021, if the Department of Justice and the independent reviewer, if the Department of Justice disputes compliance and thinks there are things that that Virginia is out of compliance, we will submit a document that explains that to the court. And then the court can create and schedule further proceedings as the court feels like it needs to. So the bottom line is that the court could extend the agreement past that date. And I just wanted to make that clear to everyone. I'm going to end with the library, which the court ordered the parties to provide by November 6, 2019, a quote document system that would allow future measurement of the consent decree, and that this system would enable interested parties, people on this webinar, family members, providers, the Disability Law Center, advocates, the ARC, to look and review documents and determine whether the Commonwealth was in compliance even after the consent decree terminates. So this library is very important. This is what the library looks like. Some of you were on that meeting today. You can go to this website. You can see the website in the upper left-hand corner. It's live right now, and it keeps track of everything that I've talked about today. All the numbers and data I got were found in this library. We're going to be working with the state, and I think even Jenny Schott was asked this question today: how will the state make sure that on this library you can easily see trends so you know whether they're doing good or bad? So are there more people going to psychiatric hospitals? Are kids in nursing facilities getting out of those nursing facilities? They need to be able to show that in an easy way so that any kind of lay person could go on this and start to figure that out. So these are also 2 websites, both on for Virginia and for DOJ, where you can find some of the things I've talked about today. Of course, this PowerPoint will be available for everyone. And this is me, my contact information, my email, Jessica's email. We've both been involved in this case for years. In fact, Benjamin Taylor, Bo Taylor, has been involved for even longer. He was involved back in 2010 when this investigation began. He's still involved in everything that we do, that Jessica and I do every single day. We work with Bo on this case, and it's a wonderful team, and we continue to be supporting and enforcing the settlement agreement. So thanks so much for having me. Thanks for giving me all this time, and I'm gonna turn it back over to Tanya now.
Well, thank you. Thank you so much. We appreciate that. When you stop sharing there, we'll have Nicole go. And folks have been writing comments and questions in the chat box, and you can continue to do that. And at the end, we're going to try to leave a few minutes for questions that can be addressed to either Nicole or Smitty. Okay, Nicole. Oh, sorry. There we go. Now we should be able to hear you.
Hello. Can you see my screen?
We can.
All right, good to go then. Okay. Hi everyone. For folks who don't know me, my name is Nicole Jorwick, and I'm the Senior Director of Policy for New York. I'm one of a 5-member public policy team, and I'm going to talk a little bit about what's going on in Washington, D.C., and mostly, obviously, right now, that has to do with what's going on with COVID relief right now. So it's hard to believe that looking at these dates when everything started, it was on March 11th when COVID-19 was first called a pandemic. And unfortunately, it has been since March 27th that we've had a big relief package passed. We know that people with disabilities who are immunocompromised are at higher risk, and generally we've seen obviously really troubling and tragic things coming out of larger congregate settings where a lot of individuals with disabilities are still living. And so there's a lot of the legislation and a lot of what's happening with COVID touches the disability community, and so we've been trying to ensure that different pieces of that have been recognized. Unfortunately, up until this point, we haven't gotten too much, but there have been some pieces in the pieces of legislation. So the first package, package one, passed. Package one and package two passed early on in the process. Package two, the main thing to note from that package from a disability perspective is that it included a 6.2% FMAP, or federal matching rate. So that's the matching rate that the federal government gives down to any state. Every state, it's somewhere between 50 and 75% are federal dollars. And so it was an additional 6.2% on top of what states usually get to support state Medicaid programs through the process. And obviously people with disabilities rely greatly on state Medicaid funding. And so that's an important tool, but it's also something that we need to work on getting continued, and I will be getting there soon. Package three is the CARES Act, or that is a bill that had several pieces of several components that assisted the disability community, but not a kind of major shot in the arm that we're looking for with the next package. Package three was the package that included PPP loans, or Paycheck Protection Program loans. Those loans I know have been extremely helpful for service providers as stopgap funding. It's unfortunately not long-term, but it's one piece that was authorized under the CARES Act. The CARES Act also had another short-term extension of the MFP, or Money Follows the Person program. That is a program that provides 100% of federal funding to states to move individuals out of institutional or nursing home settings and into the community. So that was extended until November. So those funds will be useful to states for people who need to move. Also, it included a provision that we had supported before, but it's not really COVID related, and so there's some misunderstanding about that. And this is the hospital component of the CARES Act. What it does is it allows for a state to go for a state plan amendment to fund HCBS while an individual is in the hospital. So this was something that the Senate included that is useful, but it's not specific to COVID, and it is still something that states have to apply for. So states have to go to CMS, seek a state plan amendment to add in the service. And that's because before that, I'm a family member, my brother Chris, for example, he does get waiver services in Illinois, and he broke his leg and was in the hospital, and before his direct support professionals wouldn't have been able to serve him in the hospital because he was being served there. So that is another piece of the CARES Act. In addition, the big piece of the CARES Act was the stimulus payments, and there were several pieces that came out of there that caused some problems. I'll talk a little bit more about that. And also, the CARES Act had paid leave provisions that included support for family members who might be providing caregiving services for family members with disabilities. I'm going to go back. Oh, sorry, I need to go back because I don't want to get quite into that yet. There have been a couple other short-term bills that have passed for package 3.5, because even though it's been a long time, the package that's currently being negotiated that I'm sure you're seeing about on the news is being called package 4. Package 4 is being negotiated right now in the Senate, but it's important to note that the House has already taken action. The House of Representatives passed what's called the HEROES Act on May 15th. So the CARES Act passed on March 27th. The House of Representatives took the pen, or the first round of drafting on the next package, and they passed the HEROES Act on May 15th. So that's right, almost at this point 3 months ago. And so now I'm going to talk a little bit about what's in the HEROES Act, and because it did include a lot of things that we've been pushing for. So the HEROES Act included a 2-month open enrollment period for individuals who are uninsured. Obviously, a lot of individuals are going through changes in their employment right now, so it would open up the exchanges for individuals to get coverage through the Affordable Care Act. It also provides an FMAP bump. So I talked about the package 2 that provides an FMAP bump of 6.2%. This extended that to June 30th, which is now come and gone, and then bumps it up to 14%. And so that would be an additional 14% of federal dollars that would go to supporting state Medicaid systems. We know from what we've heard from our state chapters that the 6.2% that was included in package 2 was helpful to the Medicaid system overall, but that funding didn't flow into HCBS systems. It gets sucked up by other needs before it goes to that system, which is why what we've continuing to be supporting is a dedicated funding stream for Medicaid home and community-based services. So the HEROES Act in section 30103, I could recite it in my sleep, I think at this point, includes a HCBS specific FMAP increase in lieu of a grant program. So the reason that I'm highlighting the fact that it's not a grant program is because when we were negotiating for CARES, there had been a Democratic bill that was introduced that would have provided the same type of services, so funding to states to do things like supporting workforce supports for retention and recruitment, PPE, that sort of thing, but it was in the form of a grant program. So the HEROES Act, same funding, the funding can go to the same spending areas. However, they did it as an FMAP so that the funding could get released quicker to the states. And so it's a 10% FMAP. So again, a 10% federal match on the whole Medicaid program for a state, but it would flow directly to the HCBS system. So there's clear guardrails around the use of funding. There's also clear language around supplantation. So ensuring that these dollars cannot replace funding that's already been promised by the state. This is going to be new funding because obviously state systems are going to be stressed and stretched. It's also important to note that the language in 30103 and also in the other bill is allows for the funding to be spent on individuals who are currently receiving services or who are eligible for services. So a state could choose to use some of the funding to support individuals who are currently on the waiting list. But that will be up to that will be a state level decision. But that's how the federal legislation is drafted. There are components that directly go to support the workforce. There are the dedicated 30103 that HCBS FMAP does have components that would support the workforce. It provides wage support and flexibilities for the workforce, and also ensures that there's funding for PPE or personal protective equipment. This has been a struggle, I know, at the state level and also at the federal level, is getting folks to understand that that direct support professionals, while we are not working under the medical model of service, still need the same access to support, to supplies to keep themselves and the individuals that they are serving safe, because obviously a lot of services cannot be done from 6 feet away, and so funding for PPE has been something we've been pushing for a long time. The bill for HEROES Act also included something called Family Care Fund, and it provides $850 million for child care or family care, and the definition of essential worker in that part of the bill would include direct support professionals. Outside of HEROES, I'm going to go through some other issue areas than what was included in HEROES, but I also wanted to highlight some work that we've been working on with CMS, because obviously there's been these pieces of legislation, but there's also been a lot of regulatory work. When COVID-19 came around, several states started and CMS started approving Appendix K or 1135 waivers that are actually meant to be things that support individuals in natural disaster situations, so floods, earthquakes, hurricanes, that sort of thing. So obviously those types of things are not things that typically last as long as this pandemic is lasting. So we've run into a lot of issues because CMS has said that there's some funding included in a lot of these waivers called retainer payments or contingent payments. They're called different things in different states. And that has allowed a lot of service providers, even though they've been remaining closed for their safety of individuals that they support, if they don't retain staff, et cetera, they're not going to be able to reopen. And so those have been really valuable, but CMS has limited that to 3 30-day periods. And so we're working on that with CMS to push back on that. There, in the CARES Act, there was also something called the Provider Relief Fund that provides funding for any provider that provides Medicare or Medicaid services. So obviously that's a lot broader than Medicaid HCBS providers. There's been a lot of hiccups with the rollout of that program, so we've been working on a lot of that. We've obviously also been ensuring that as we're looking at what's going on in congregate settings and other components of transitions and that sort of thing, that we're keeping in mind Olmstead that Cindy was talking about before. And also we're having a lot of concerns because there's a lot of data reporting that's being required out of nursing homes. However, we've been pushing really hard with both CMS and the Hill about the need to collect that data and require that data for other states. I know Virginia is actually doing a lot of reporting, which is great. There are some states that are being transparent, but a lot that are not. And so we need to make sure that that same level of data collection is being done outside of just nursing home. And also that nursing home data is aggregated by disability. The CARES Act, so again, that was package 3, did include significant funding for housing, including specifically Section 811 housing that supports people with disabilities. It did have some protections for foreclosure and eviction. What we're seeking, but was not included in HEROES and also wasn't included in HEALS, which is the Senate bill, was more broad moratoriums on evictions and that sort of thing. But it's something that we're monitoring closely, and also ensuring that any emergency rental assistance and everything is available so that people don't unnecessarily end up institutionalized. As far as civil rights, obviously we're working to ensure that we make sure that it's hard to believe that it was only, I think, a week and a half ago that we were celebrating the 30th anniversary of the Americans with Disabilities Act. It's, you know, the biggest piece of non-discrimination legislation for people with disabilities, and so we have to ensure that that same disability discrimination is not happening in the era of COVID. There's been a lot of concerns around medical rationing of care. The ARC has been involved in several pieces of litigation in several different states on that issue, actually working alongside the administration in the Office of Civil Rights around those pieces and ensuring that people with disabilities receive the same care no matter their disability. Also, visitor policies have become emerging issues, and we keep ensuring that we are making sure that the disability voice is at the table when those conversations are going on, whether we're talking about congregate settings or other settings. The nonprofit provision, so that's, there's been several components. I talked about the PPP, or the Paycheck Protection Program loans that were part of the CARES Act. We're wanting to ensure that those continue to be available, and that the spending of those funds that was already extended until almost the end of the year, so that will be helpful. We're still seeking to support other loans and funding structures that will support larger nonprofits, because within the ARC network, we do have some larger nonprofits just because of the way that they're structured. And we want to ensure that there are full unemployment benefit reimbursements for some providers who we know self-insure. On the education front, the CARES Act did include flexible pots of money, none specifically for disability, but all included the funding for serving individual students with disabilities. We're still seeking to ensure that there's no waivers of the IDEA. There had been some conversations when CARES was being negotiated in March around waivers of IDEA. However, at this point, we aren't seeing a major push that direction, and it's just really important. I know this is a major topic that we have among our state executive directors around safe school openings, what that looks like, the time and progress that might have been lost. All those things are things that we're thinking of. And all of the pieces of legislation, whether it's CARES or the first two or what we're talking about now, these are considered relief packages. And most likely package 4 is going to be the final relief package, but at some point there will most likely be recovery packages, and education, I think, is going to be in the prime position, specifically special education services, because I think we're going to be seeing for a long time the concerns there. The stimulus payments, so the CARES Act authorized $1,200 payments for many individuals and $500 dependent credits. The payments are tax rebates and aren't counted as assets for the first 12 months as long as they're spent. There had been a lot of problems when the CARES Act first was became law. For example, for a while, the Social Security Administration was saying that individuals who receive Social Security were going to have to file taxes. Many don't. However, with administrative advocacy, that was changed, and so now automatic payments are being made to people on SSI or SSDI. Dependent credits, so in package 4 in the HEROES Act, dependent credits for adult children was included. And before that, if an adult with a disability was declared a dependent on their taxes, they were not allowed to receive that $500. That was fixed in package 4, so we'll need to ensure that that stays part of whatever ultimately becomes law. The Families First, so the second package did include 12 weeks of emergency paid sick and 12 weeks of emergency paid leave and included tax credits as well. The CARES Act fixed some of those provisions from the second bill to ensure that those paid leave provisions were not just for childcare, but were also for providing services for adults and family members with disabilities and other caregiving responsibilities. We are continuing to, in package 4, we fought to ensure that grandparents who might be caring for an individual with a disability or siblings would also be included. So really, for both stimulus and paid leave, it's about ensuring that there's no limitations, that all individuals and family members have access to those provisions. So I just went through not all of our issues. The whole policy team covers a much wider breadth of issues, but a lot of our issues. But the priority issues that the ARC has been focusing on, and again, that doesn't mean it's all that we're working on. We've just been really careful to speak with one voice. Because a lot of feedback that we got with the negotiations for the third package was that they wanted to do something and they weren't really sure, and that's how we ended up with the hospital bill that was helpful, but it wasn't the same thing as federal funding for HCBS. And so we've really focused on funding for Medicaid, that's grant program, that's wrong, Medicaid FMAP. Again, access to PPE, paid leave for caregivers, and economic impact payments or stimulus payments without any barriers. So we've continued to focus on that. And so again, the HEROES Act passed on May 15th, and then the HEALS Act passed, did not pass, and is not expected to pass, but was introduced last week on July 28th. It did not, this is a side-by-side that we did for chapters that I just turned into some slides. So I already talked about what the HEROES Act has as far as a 10% FMAP bump. The HEALS Act had no funding for HCBS. So that's what we've been yelling and screaming about. That's why I'm sort of losing my voice. Been on a lot of phone calls. As far as broader Medicaid funding, the HEROES Act had, again, that 6.2% FMAP that bumps up to 14%. To support the broader Medicaid program. The HEALS Act had no funding for Medicaid. As far as paid leave, again, the HEROES Act expanded those provisions to ensure that nobody was left out and expanded employer tax credits. The HEALS Act didn't take on paid leave at all. Around stimulus payments, again, it extended those payments to ensure that people were not left out of the payments, and also disregards unemployment insurance from income and asset tests. The HEALS Act doesn't issue a second round of stimulus payments, and also does have the fix for the $500 credit for all adult dependents. So it does include that in the next round of stimulus in HEALS. So those are kind of our, that's kind of the update on where things are. Things are currently being negotiated right now with the Senate. Some action steps that you can take. The ARC, I don't know, I think 3 months ago now, or maybe more, we started the hashtag We Are Essential campaign because to highlight the fact that as a community, these are our needs. So we've been focusing on those 4 priority issues. There are ways that you can share your story. The ARC Action Center is at thearc.org/action. That's where you can find any tools for what we need to do. So we'll expect package 4. I shouldn't say expect. There's no expecting anything right now, but we anticipate, and what I'm hearing as of an hour ago, is that we will still hope that something will come together over the weekend. Originally, the Senate was supposed to leave on recess tomorrow. That's not going to happen. And so that they will stay in and hopefully be drafting the legislation over the next week. I still hope that they will pass something by the end of next week. It could lead into the week after that, but we do know that both senators and representatives want to be home, obviously because of the pandemic, and also for other things that are going on in November. And We anticipate that it's very possible that hopefully once they pass a package 4, that there might not be a lot of legislative activity until after the election. And then hopefully that's when we'll turn to recovery. And also that's when we'll turn to bigger picture ideas. The pandemic has highlighted some things that the ARC has been advocating for, and the disability community for a long time has been advocating for, which is around the fact that right now in Medicaid, the home and community-based services, part of why we have to fight so hard for these dollars is the fact that those services under the federal Medicaid law are optional, while other services like nursing home services, institutional services are mandatory. And so that's why we have this extreme need for HCBS dollars, because without it, people are at real risk of ending up unnecessarily institutionalized. And so we will look to fix that problem, fix what we call the institutional bias of the Medicaid program. That's something that's been in the ARC's legislative agenda for decades, and frankly, I don't think we're going to have a better moment in time to address it. And so we're going to work on doing those sort of things. And so I just want to kind of not end because I know we have a lot of time for questions, but just highlight that fact that it's really scary right now. We don't know what's going to happen, but there are some good things going on that will ultimately lead to more need for push and advocacy, but a push and advocacy for something good, like making sure that we have access for those services for home and community-based services for all people. And if those services were mandatory, that would mean there were no waiting lists in states like Virginia and in my home state of Illinois. And so that would be really major. It'll be a heavy lift, but it will be something we can turn to once we get the funding that is needed to keep things afloat during COVID-19. And another thing kind of on the positive front is that we have seen a lot of, anecdotally, I've been hearing a lot of stories about positive outcomes for individuals who are receiving services virtually. It doesn't mean they want to receive them virtually always, but it means that all of a sudden they're expressing their opinion, exerting their voice in a way that they might not have in a different setting. And so we'll continue to work with CMS to ensure that those sort of services are continuing to be funded during the national emergency, and also how we can help states to get those types of services funded through their waivers coming out. So I think at that point, I want to leave plenty of time for questions, so I'll turn it back to Tanya. Stop sharing my screen.
So I think what's going to happen now is, Lucy, are you going to you're going to take over for the questions? Lucy? All right, well then I will take over. Can everybody hear me?
Yes.
Okay, good. All right.
Yes, I can.
How are you doing?
Great.
It's good to see you. You're not sick, right? I mean, you're just kind of coughing a little bit. You look kind of wrapped up in your coat. Are you feeling okay?
Yes, I'm feeling fine. Thank you very much.
You know,
It's just from talking so much to the hill, I swear.
Okay, I see that Lucy is unmuted, so I'm going to turn it over to Lucy.
Okay. Hello, everyone. So there are great comments in the chat box about the presentations, both of them just being very, very informative. So thank you very much. And of course, we have to acknowledge that the 5-year-old has lost her tooth. So we know that the ferry will be very busy at your house this evening, Smitty.
We got a lot of work to do tonight, I know.
Yep.
Well, not to take any time, Smitty, but you're better off with a bag of coins than a dollar bill. Because my mother-in-law used to make me look really bad because we'd put $1 and she'd give a bag of pennies, and my daughter would go crazy over the pennies. Over the, yeah, okay, you get it.
Okay, Reed Eaton is saying that he's been waiting over 3 years for DARS and he's asking for help. And I think maybe you have an answer for that, Smitty, or you have talked with Reed about that?
No, I don't have a specific answer to that. I need to know more from Reed about what that problem, where the problem is there. I think I gave you my email the other day in one meeting, so maybe you could shoot me an email and I could try to connect you with. I've got one really good DARS contact who seems like they want to bust barriers and figure things out. So maybe I can pass that person or tell that person about you and try to figure out what the problem is there.
Okay, Lily's expressing concern. Of course, we're all concerned about people who might be exposed to the virus, especially people who are in congregate settings. And Nicole, would you like to speak to that about congregate settings people are in?
Yeah, I mean, I share that concern. It's something that I know that we're talking a lot with federal CMS. I actually think I just put a meeting on my calendar for next week on that issue. I know in my home state of Illinois, the National Guard was called in because in 2 of the institutions, there's 7 there. Half of the individuals there were infected. It's something I'm extremely worried about. It's something, frankly, that we worked really hard to try to get media to pay attention to with minimal luck, aside from Joe Shapiro from NPR. So, we're really worried about that too. There's some strong data coming out of Syracuse University from Dr. Scott Landis about the infection rate for people with disabilities. And so we are using all that really troubling information and things that are upsetting, because those things upset me too, to put the pressure and keep the pressure on Congress. And also those are the things that we're going to use again when we're going to push for fixing this problem once and for all and making HCBS mandatory, so people who choose to have choices about where to live, including in their homes and communities.
So Nicole, all of us could be a part of helping this to improve, and you all put out action alerts. Could you fill people in on action alerts and how they can help?
Yeah, thanks, Lucy. Action alerts are really important. So I mentioned earlier the arc.org/action, and I'll put it in the chat box too. But that's a really easy way to do it, because we just created, perfect timing this year, a new system where you just fill out one thing with your information, and it tweets, it emails, and it calls your senator about the issue that you choose. And so the HCBS issue, if the HCBS issue touches on the congregate care issue, you can select that issue. We also have a storytelling piece where you can write about why that's concerning to you. All of those things are going to be really helpful when we are making the push, because it's really important that senators and representatives are hearing directly from the folks that live in Virginia.
So if people aren't familiar with that, you can always go to the ARC of the US's Facebook page where they post the action alerts. And sometimes you all send out information alerts on that too, don't you?
Mm-hmm.
Yeah.
Yep. If you get on our list, which you'll do if you send an action alert, then anytime we send out a request for action. So Tuesday we had a big national call-in day for HCBS, and we sent out an action alert to our 300,000 person list or what have you. So if you send an action alert, then you'll be able to get on that list. And we've been able to get, I think, close to 100,000, if not more, actions already to Congress. And those things really matter. And we're hoping that we see that reflected when the bill gets passed.
Right. Okay. Money follows the person.
Hey, Lucy, can I respond to that too? I want to give a little more information about the congregate and nursing facilities in particular for Virginia, because DOJ has been focused. We've raised that very acutely with the state of Virginia, and we have been in the past focused on 2 nursing facilities, because there are 2 nursing facilities where there are kids, and that's been kind of a narrow part of. So ILIF and St. Mary's, I think, are the 2 that come to my mind. And one of the things that we have heard from the state is that since March, there have been no deaths of people with developmental disabilities in nursing facilities due to COVID, which is a positive statement. I think we heard that it might have been a couple weeks ago, so there could have been deaths in the last couple weeks. But then we also asked them, could you tell us everybody who has a developmental disability in these, at least these 2 nursing facilities, and whether they've gotten a positive test for COVID. And the answer to that was one that was fairly unacceptable, and we're continuing to push them on it. But basically what they've told us is that they, when the information goes to the health department on, nursing facility ILIF had this person that got COVID, when they give that information, it's unclear. It's clear that they don't give a diagnosis when they give that information. So the state then has to then figure out and align who they know has a developmental disability in this nursing facility, and whether then that person is the person that went to the health department. It's not kind of lined up neatly as it should be. And so we've told them, thanks for telling us that. Now figure out how you can, you should know that you're paying for these people. Medicaid is paying for these people with developmental disabilities in these nursing facilities. You need to figure that out. So they've continued to tell us, we're working on it and we'll figure it out. We've continued to tell them, we trust that you're smart enough to figure this out. Go figure it out. So I just wanted to give that update that Lily, that concerns us as well.
Sure, that's an important concern. Susan brought up MFP, and if you're not familiar with that, that is a program, and either of you can correct me, that assists people who are in some sort of nursing facility funding to move into the community. And this also led Susan to talk about the fact that her son has a community living waiver, but many families, we get calls about this all the time, families feel like they cannot leave the state they're in. They can't leave Virginia because if you go to another state, you're starting all over to try and get a waiver. And Nicole, the ARC of the US has worked on this.
Sure. So yeah, money follows the person is not what it sounds like, because I get this question a lot. So money follows the person. My brother has waiver services. If he wanted in Illinois, if he wanted to move to live with me, it does not mean that money follows him here. Money follows the person is a very specific program that's about money that's currently being spent in an institution or nursing facility, following that individual in that same state to a community-based service. So that's one thing. What you're talking about individuals moving is what we call Medicaid portability. And that is also something that the ARC it's a huge issue and a major issue that's been on our priority list. The biggest thing we need to do to make Medicaid portability happen is to fix that institutional bias that I talked about. Because the biggest reason that you can't just move from one state to another is because there's waiting lists. There's also difference in services. And so the bills that I'm anticipating, I might know a few things, but I can't say too much, that will be coming out soon will deal with that. It will deal with not only, because if you get people off waiting lists, then people can move. And also it'll deal with making sure that there's some consistency between the Medicaid programs. Because right now it's a federal law with a state and federal partnership for funding. And so what is actually, the services are varying in state to state. So it's going to be hard to make it completely uniform, but we're going to do our best through federal legislation to make it a little bit more aligned throughout the states.
Okay, that's been a huge problem for years, so we appreciate the ARC's work on that. Oh, this is such a big issue for so many people. It's harder now to find caregivers. Do you have any advice so that people with disabilities can remain living in the community?
Yeah. Workforce issues are extremely, are really, really, really difficult. And it's, we do know that there are going to be people who, there's obviously a large group of people who've lost employment. That doesn't mean that every person who's lost employment would be a good direct support professional. To be clear, as a family member, I know that. But there will be hopefully some influx in individuals interested in the workforce. However, we have to fix the problems with pay, and we have to fix the problems with ability to grow in the position and that sort of thing. And that is also something that we're working on. So there are small components in the COVID legislation. We're also about to sign on to this big white paper around supporting workforce and the infrastructure of what it means to have caregiving and what that looks like. And so in addition to big fixes to the Medicaid program, ensuring that there's workforce. As far as advice on how to find folks, I mean, that's really tough. I mean, I know as a family member, we've had a hard time with that. But you know, local colleges can sometimes have stuff, but it's just really hard.
It is hard. One of the biggest stumbling blocks that people run into. So Lily is saying that she's having trouble getting her stimulus payment because apparently there's some mix-up saying that she filed as a dependent. And so they've said that she can file for a credit. So for people who have had trouble with getting their stimulus payment, Nicole, do you have any advice?
Yeah, so first, if you haven't gotten it yet, that's shouldn't be a surprise. They're still working on getting them all sent out. If you were declared a dependent and you're not one, then you will have to file an amendment on your taxes. That would just be true no matter what. But even if you talk to your family and maybe that was accurate, the fix will be in the bill where you would then at least still be eligible for that 500.
Okay. Always hoops, aren't there?
Yeah.
If there's any other comments or questions, feel free to put them in the chat. There was a discussion going on about SRAP, and Kyle was in on that discussion, giving information. Kyle, if you're available, please come back in and explain that to us, if you will.
Yeah, so the question was about, the way that I interpreted the question, you can interpret it two different ways, but one of the things is, okay, so I have the state rental assistance, right? I got the ticket, but now I have to go find the housing that will take that ticket, and whether housing developments will allow me to not pay with cash money because I'm working, but instead pay with my rental assistance. And the question was, the one way that I understood that question was, how can advocates, family members, how can they be in a position to go to landlord X and say, landlord X, you should take this state rental assistance payment? And what I have heard as success stories is the coordinators who work with SRAP, who I put in the housing team in the chat, the list of those folks, that's one barrier that they find. They have an individual who wants independent housing, has been able to get the rental assistance ticket, but then hasn't been able to find a housing authority that will help them. And so those state workers will make the rounds and try to explain, this is a good thing for you to do. It's important, it's fair, it's also the right thing to do. They've been able to smooth over those edges. And so I told folks in the chat that they should reach out to those coordinators, especially Jeanine Cummings, who was an advocate herself and now works for the state and has that kind of view in mind. I also talked about the fact that the low-income housing tax credit is another program that is incredibly complicated, but the basic gist is, I'm a developer, a housing developer. I wanna develop a new housing unit. This could take years to do, but it's going to be new housing stock in, say, Richmond or Roanoke. And in order to do that, I compete with other housing developers to get a tax credit, which is basically free money, a ton of free money. But in able to get that free money, they give you get points for doing certain things. And one of the ways you get points is by saying you're going to serve people with developmental disabilities. That's a new thing. That's something that the settlement agreement and negotiations with us and the housing authorities in Virginia got them to put in their point system. And we actually had to do some legal finagling to make that work. But that then creates an incentive for people to serve people with developmental disabilities, and then have housing units that are affordable and accessible. And then these housing developers get a win and the community gets a win. So that's a program that's in their housing plan. They have developed, in my mind, I think only maybe a dozen or so of these housing units. This is something that takes years to develop. I think there's been more that have been approved but haven't been developed yet. So that's just so you know, like that's another area that kind of sliver of all the work that we've been doing over the last 8 years.
Okay, thank you. That was very helpful. And of course, accessible is a key word because so many people who have mobility concerns, it's often very hard to find housing that will suit them and be accessible. So we have back to stimulus payments. Karen said we didn't get $500 either. So I'm thinking you're referring to the $500 stimulus that went to minor age children, if that's what you're speaking of. Nicole, anything on that you'd like to add?
So, right. So if you're an adult dependent, you wouldn't have received the $500 yet because that law hasn't passed yet. And if you're a child who's declared as a dependent under 17, it's taking the IRS some time to get the funding out. So I hate to say be patient, but that's just what you have to do right now.
Okay. Patience is really the order of the day during a pandemic, isn't it? Yeah, we've all had to use a lot of patience. Okay, any parting words or any parting questions from the audience? We've gotten so much good, rich information this afternoon.
Oh, so we had one question early on that Jessica just alerted me to, which was great. Who was it from? I'll just acknowledge. Oh yeah, it was from Lily. It was a great question that anyone could ask. And that's sort of, once the consent decree is over, and like I said earlier, you don't know when it's going to be over exactly, because there may be things happening in January and then the judge has to make decisions. But let's just assume, let's just go into the world where the consent decree is over. And I have to come to your convention as Kyle Smitty and not the DOJ. What will happen? And this is something that Judge Gibney has been thinking about, and part of his, so far, his answer to that is this library, which will be a place where the DOJ and the Disability Law Center, other advocates, even the court, if it wanted to, could continue to check in and see how they're doing. And the question was, who will monitor if it's not DOJ? Will it be someone else monitoring Virginia? The straight answer to that is, if DOJ is not monitoring, the monitoring, because they've reached compliance, the monitoring, at least the way that I've understand these cases, is that it will be over. The judge has made an indication that this library would give a chance that, let's say, the General Assembly, decides to stop spending money on crisis services, and crisis services completely disappears from the agreement and is no longer functioning. That then the library would be a way for Virginia to alert the court and DOJ attorneys that this is happening. I'm not exactly sure what would happen then. We don't really know, but the judge's point is, I've ordered this. You can't just, after you comply, then kind of go away and stop doing the things that I've ordered, because it's a continued agreement. So it's still a little bit unknown, but that's kind of the best answer that we understand at this point.
If I could jump in for 1 minute, the only additional thing that I would say is, I think you should all use the library as a resource. DBHDS is really developing it now, and I think there's a lot more work that needs to be done. But ultimately, they should really be including a lot of information in the library about what services are out there, how they're growing, how they're working, things like crisis. Are people going to psychiatric hospitals? And if so, what's happening? Are the numbers increasing? Are people waiting to get into the crisis therapeutic homes? All of these things that really impact people on a day-to-day basis. And so I think it's worth everyone here thinking about, when DOJ leaves, when Virginia actually meets all the terms of the settlement, this is going to be a great tool for you to use to say, hey, Virginia, there's still more work to do. Or we see that, you know, you're slipping in this area. It looks like more people are going into psychiatric hospitals. Like, what are you going to do about it? So I encourage you all, like, as it improves, to use it as a resource.
Excellent advice. Thank you, Jessica. This is a little bit off topic. Oh, there's Nicole. Nicole, I know we've all had to pivot our attention to the pandemic we're dealing with, the marriage penalty. Can you just tell us where that stands right now?
Sure. So I will say that, so that's not something that there's active litigation or litigation. Sorry, I've been listening to the lawyers talk. Active legislation around right now. But it is definitely something that my colleague Bethany Lilly, who's our director of income policy, is working on. I know it's the top priority of the ARC's National Council on Self-Advocates, so it's definitely something that we're working on. And I do think that actually there's going to be some traction on the Hill, and so I really think that it's something that we should hopefully see some action on. I do want to clarify whether it's talking about the marriage penalty or that other big bill I was talking about that would handle the institutional bias of Medicaid. Those are both bills that are going to take a long time to get passed. But we're going to push really hard. So I just want to, be clear with expectations that it might take more than a month or two to get all these things done. But it'll help more the more that everyone's advocating. So I guess the last thing that I would say, since I see that we're running short on time, is that even if you already have, reach out to your senators. I know that you have senators that tend to be strong on disability issues, but they should always be reminded of the top priorities of the people that they're representing. And thank you for allowing me to be part of your convention today.
Oh, thank you so much. And in the chat, Kim Goodlow is saying, thank you guys for being there for us. So we say that to our panelists, and thank you for being here today for us very much. Goodbye.
Thank you. Bye.
See you later this evening.
Bye.
Bye, everyone. Thanks so much. Take care.
Thank you.